Bangladesh Dustho Shastho Kendra DSK, a local NGO with its dynamic leadership of Dr. Dibalud Singha, has successfully created a model to supply drinking water to slum dwellers in Dhaka and Chittagong city. The slum residents have no legal access to the water supply and sanitation systems of the city authorities, but DSK managed to establish their right to water and sanitation through legal means. They have built water points inside the slum and inhabitants can use and bring water from those points. Dibalud Singha said,
in urban areas, we did start a water and sanitation project long back. It was in early 90s, and this project was initiated because of the fact that people living in slums at that time actually opined and observed that they are in need of drinking water supply. Now it is being recognized as DSK model, and apart from DSK, other non-government organizations, they are also replicating this model. We are implementing this project not only in Dhaka but in Chittagong as well. And basically now Dhaka Wasa has published its gadget through which slum dwellers who are in need of this type of water supply, they can apply to Dhaka Wasa and get access to water supply. Through this model, actually it has been proved that if we can provide access to basic service to people who are living in slums and squatters, they are being benefited. That is number one. But on the other hand, it has also demonstrated their willingness to pay for the service. So because of above, this model is working. And I also like to comment that Dhaka Wasa is providing drinking water to clients on less than cost price. So in one hand, we see people living in urban slums or Dhaka city slums, they are purchasing water. One jar of water is 1 taka. We call it in our language kolshi. That is 1 taka. On the other hand, normal clients of Dhaka Wasa, they purchase 1000 liter of water at 6 taka per 1000 liter. So there is a very big difference between these two, market price and the Dhaka Wasa price. So that somehow we need to actually address this issue in future.
As part of the objective to improve slum dwellers' health, behavior and practices, DSK considered water supply and sanitation as top of the priority, and the DSK model has been proved to be an effective and useful for healthy living of the slum dwellers. It is also evident that poor people are willing to pay more with improved services.